Ali Greco is a registered physiotherapist at Lake Superior Physiotherapy and a certified Pilates instructor at Fit Bodies, Fit Minds. Ali's ultimate goal is to introduce individuals to Pilates training and rehab so they can align their bodies, stay mobile, and return to all activities they love without symptoms or discomfort. Ali, welcome to Elevating Women's Wellness. Thank you for being here.
Thank you for having me.
So, tell us about yourself and how you became interested in physiotherapy and Pilates.
So I don't have like a super elaborate story on why I decided to become a physio. I think just overall, I really wanted to help people, and so I really like movement and the body. So I think this is perfect, and I really believe exercise is the best medicine, and just trying to help people move better without relying on medications is really important. And I started my journey at Lake Superior State. Um, and so they provided me with a lot of practicum experiences, which kind of allowed me to explore physio. And it just kind of solidified that this is what I wanted to pursue. And after a lot of hard work and dedication, I was accepted into Western's Master of Physical Therapy program. And that's kind of when the Pilates interest really bloomed. And I had done Pilates here with Kyla actually when she first started when I was in high school, and I loved it. And then when I was down south, I discovered the reformer, and that's when I fell in love with that. And I started to see physios incorporating the reformer with their physio practice. And I thought that was super cool. And I really just used that reformer as kind of like my outlet. It just helped made me feel really good, made me feel strong. And I just thought like this is incredible. And I just want all my future patients to feel that way too. And when I was home, I would do classes at Kyla's. And then once I moved home, I got a job at Fit Bodies as well, and that really pushed me to get my certifications. So now I teach there, and it's just really awesome incorporating this machine into my physio practice and just teaching classes. And there's no better feeling than watching people smile and just feel great after engaging in this type of activity. So that's kind of how that all came about.
Oh, that's so neat. I love the marrying of these different modalities and treatment options. I think that's really neat. You had mentioned something that exercise is the best medicine. Can you tell us more about that?
Well, I just think it's so important for us to be moving our bodies, at least 5 times a week. As we get older, it gets a little harder to move, and we might have injuries from when we were younger, or we might have injuries as we get older, and it might make things a little harder. Like, it might be hard to play with your grandkids or participate in sport. And as you get older, you might develop conditions and might be on some medications. So I just think it's really important that we keep our bodies moving and healthy. Maybe try and stay that way so we don't have to take as many medications. But I just think if we keep moving, it's just the best thing for us. Like, as we get older, you want to be able to participate in as much as you can, and you just want to be able to live your best life and, not be sore or in pain all the time. So I just really think it is the best medicine. Even walking 30 minutes a day is fantastic.
Yeah, absolutely. And, with exercise and movement, it can help on all levels, physical. Also, sometimes people say like they can clear emotions when they go for a walk or they move in some way, or that they feel better mentally. Would you agree?
Oh, 100%. And I mean, I even feel that way. Sometimes I dread a workout. I'm just kind of feeling lazy. And after the workout, I feel awesome. I have so much energy. I just feel fantastic. And that's kind of what I used the reformer for when I was stressed out in London, Ontario. And, we're at the end of the program, and I just bought a package of reformer classes, and I just looked forward to that. And that really helped me get through that last month.
Amazing. And so, for those in our audience who might not be familiar, what is a reformer?
So a reformer is a Pilates apparatus. It's quite large, but it's pretty incredible. There's not much this thing can't do. There's basically a carriage. It's a long machine. There's a carriage. There's a bunch of different springs. The springs have all different levels of difficulty. So there's heavy, medium, and light. There's a little bar at the front, and some machines might even have like a tower at the back. There's some straps along with it as well. So you can put your feet in the straps, your hands in the straps. You can lay on this machine, you can stand on this machine, on your stomach, your back, 4-point position. And it's just a low impact type of exercise. So the resistance is really great because you just make it more suitable for everyone. So if something's too tough, you just take off a spring, or if something's too easy, you just add a spring. And again, there's so many positions you can be on and get the same effect and same workout. It's just more comfortable for people, and it's quite incredible.
That's great. Thank you so much. for elaborating on that. I think it's interesting to, as a learning experience, to hear from you. Who are the typical clients that you work with in your practice?
So in terms of like a clinical Pilates as a physio, I would say a lot of knees and hips, low back, just in general as a physio, a lot of shoulders, still a lot of back, so and knees. And then as a Pilates instructor, I have a lot of people that, have just had a child, postnatal, or people that are just new to fitness and they're just not really sure where to start. So definitely see all ages, all populations. So it gives me a lot of experience with pretty much everyone, which is really, really great.
Mm-hmm. What are the common problems with joints that you treat? What are the common issues that tend to show up there?
I would say, arthritis in the knee, arthritis in the hip or the back. And that's again where this low impact exercise can be really, really helpful. If someone has pain, let's say squatting, well, you can just go on the reformer, change the spring setting, and you're essentially doing a squat on your back. So it just allows them to get the same type of movement and that same benefit of strength and mobility without being in pain. And again, that kind of goes for hips and knees. And then I do a lot of mat work stuff with the low backs, just to kind of strengthen core and the inner and the outer units of our core. So yeah, I definitely see a lot of those. And then some ligament injuries as well, meniscus, those kinds of things where you want to strengthen the stabilizers and kind of get the joint strong so, the knee's not giving out on them or what have you.
Yeah. So you had mentioned, so arthritis and injuries are the typical joint problems that you tend to see in those areas that are affected.
Yeah.
Mm-hmm. And what considerations need to be kept in mind for exercise with arthritis? Because as you mentioned, exercise is the best medicine, but I would imagine too, sometimes people might shy away from that if they're in pain. So what needs to be kept in mind to do that safely and effectively?
I think just knowing like when you have a flare up, because some people may not even know when they're having a flare up. And there are different kinds of arthritises. So just, understanding your type of arthritis, knowing when you have that flare up and knowing how to manage it. So, some people are go-getters and they just want to go, go, go and do all the exercises. But sometimes, you need to educate them on when to take a step back and just guiding them through that and saying, okay, maybe these are the exercises that you're going to do when you're having a day where maybe you have some swelling or pain. And this is what you'll do when you're having a really good day, and giving them pain management strategies, I think, is important. And then even when they're in the clinic, just being able to take that step back and saying, okay, we're not going to exercise today. Maybe we'll use, a modality or some other technique to kind of calm things down. So I think providing them with education on like their type, pain management, and when to take a step back is really, really important for them.
Yeah, which is great to know that there's options. You don't have to go full speed all the time. Sometimes that can create risk potentially of maybe injury or re-injury. So I think it's great to know that there's options and still things that you can do no matter how you might be feeling.
Yeah, definitely.
So overall, what role does modifying play when it comes to maybe the Pilates side of things?
Well, I think Pilates is just a really inclusive type of exercise, which is why I love it. No matter what condition you have, like your fitness experience or level, Pilates really is for everyone. And so, but sometimes things aren't comfortable for people. You have a class filled with, let's say, 8 people, and everyone's at different fitness levels. Everyone has different, health histories and body types and fitness experiences. And so, I guide them through modifications, whether it's something that's more challenging or something that's easier. And so maybe just offering them a different position, a different weight, maybe no weight, and just always making sure things will look good in terms of form so they don't hurt themselves, and just feel comfortable. Because sometimes people will be going through an exercise and they think they're doing it right and they're on a super heavy spring setting, but I notice all these incorrect body positions and form where you might hurt yourself if you keep on doing this. Let's try a lighter spring setting, and then now you have good form and now you're not going to hurt yourself. So just knowing how to modify in both directions, because you don't want the class to be boring for other people either. So I always have things in the back of my mind ready for maybe we'll add a prop if this is too easy, or maybe we'll take away the prop if this is too hard. So just always being ready to provide modifications, I think is important. So people feel included and they don't feel uncomfortable or embarrassed, or, it can be kind of scary, especially if you're in a class alone. or even just when you see the reformer, you're like, oh my God, what is this thing? And it can be kind of daunting. So I always reassure people, I will provide modifications to make sure that this is a comfortable and good experience for you.
Great. And I think it's important too for people maybe first starting exercise or first getting into fitness. Like, what could you tell them to help people considering approaching exercise and fitness for the first time? What could you tell them to sort of ease their mind?
I would just say be gentle with yourselves, be patient. Strength training or any kind of exercise, it takes time. It doesn't happen overnight. Our bodies are incredible and they change, as we age and as we go through experiences. But I think we need to just be gentle with ourselves. I think we need to start slow and gradual. I think we need to have an expectation that's realistic, because if we think like, I'm going to work out for a week every day and I'm going to like look different or feel different, that's not always the truth at all. Like it takes months to see changes or feel changes. And if you go, too fast too soon, or you do too much too soon, that's when you're at risk for injury. So I think, it's just important to be gentle and be kind with yourself and just take it day by day and listen to your body. Just because people are doing something else for their body doesn't mean that it's right for yours. We all have different health backgrounds and experiences with fitness. And I think we just need to remember that and just be kind to ourselves.
Oh, I love that message. I hope that is really encouraging to those listening who are considering starting an exercise program or getting into fitness. I think that's great to hear. So, what are common obstacles that might come up for women who might be healing from a joint injury?
Females, we have different body structure. And again, if you've given birth, you're going to have a bunch of other obstacles as well. So, women have a little bit more ligament laxity. So that's kind of an obstacle there, whether they've already had an injury or what have you. We do have wider hips than men for childbirth. So that can kind of affect alignment a little bit in the lower body or in the back. And that can, of course, affect the joints. And then, as we age and, estrogen plays a role in cartilage health. So as that decreases, the cushioning, the cartilage provides decreases too. So then you're kind of dealing with that and potentially menopause, and your body's just going through all these changes. And, it's tough. And again, just being patient and knowing what is best for you, I think is important. And I think something else that anyone deals with, no matter what your age is body image. And, there's this unrealistic idea of what a woman's body should look like, and that can be really, really tough. So, just as long as you feel good, and I think that's just what's important. And yeah.
Yeah, for sure. Feeling good. And earlier too, you had mentioned the importance of form.
Mhm.
I want to hear a little bit more about that, because sometimes if people may have unrealistic expectations about their bodies or what their goals are, what they want their bodies to look like, they might push themselves too hard. But how important is it for us to pay attention to form?
It's so important, especially when dealing with core strength. So just, I always start my classes with, this is what a neutral spine should look like, whether it's laying on your back, kneeling, standing, sitting in a 4-point position. I always draw their attention to neutral. So small space in the low back, heavy in the pelvis, heavy in the ribs, because then if you're doing an exercise and your ribs start to lift and your back starts to arch, well, now you're really compressing through the back. And if they don't say anything, or they think that's what it's supposed to feel like, then they might hurt themselves. So an example on the reformer is when you put your feet in the straps and your back is flat along the machine, the straps and the resistance can pull your bum up. So if people don't anchor through that pelvis, they're going to start to pull through their back, and then that's when they're going to cause injury. But I find that people become embarrassed if they don't have heavy springs on. And I always, I say first thing in the class, like, do what's comfortable for you. We're all at different stages. You want to get the most out of the workout. And that's sometimes even just setting up a neutral is such a workout. And it can be so tough for people, but it's just better to start there so you get the most out of it. Because then you're going to start working incorrect muscles, and then you might just feel sore after. So form is super important. You don't want to hurt your back. You don't want to hurt anything. So I think just, listening to the instructor and trying your best, and just not being embarrassed if you're not getting an exercise, or if you're not on a super heavy resistance or what have you.
Yeah, thank you for mentioning that. And I think at the same time, that's what makes the difference of being in person too. And now whether it's in a physiotherapy setting or class setting, because you can get that help and support for your own individual body versus just some general statement. And form is often learned through like a felt sense. It's not, you really have to sort of internalize that, right?
For sure. And that's where cueing is really important, and just finding the right words to help people find those muscles. Because if they've never, worked those muscles, like they can be hard to find sometimes. They're there, but sometimes it's just hard to visualize and draw their attention to it. But yeah, and sometimes, tactile cueing is important, and that can be tough right now. But I mean, if people are willing, it can be a good way to find those muscles and kind of help get them into a good form.
Yes, absolutely. And if a woman was looking to strengthen her joints, that was her goal, because maybe her health history, maybe her personal family medical history, something like that, that's come up, and she knows that strengthening her joints, protecting her joints as she ages is a goal for her. What steps can she take?
I mean, I think the first step is just looking for a professional that can help you and help that woman, and just making sure it's an appropriate professional that knows, where to begin and how to deal with those maybe health conditions or health history. You want to do your research there and just make sure you're going to the appropriate person. Looking for low impact options. I think that's a really good start. It's a good way to introduce exercise. It's nice and gradual. It's easy on the joints. And then again, Pilates is great because it's low impact. But what else is nice about Pilates, and I think Pilates is for everyone. I think men should try Pilates, but I would say 199 to 100% of my classes are women. So then that brings in a support system. So I think that's really nice for women. They meet friends, and then, they might even come to the classes just because their friend's going to be there. And I think that's really nice, is just having that support system of other women. And then again, just like with all of this, be gentle with yourself and just keep it slow, keep it gradual. Find something that you love. It might be a hobby or an activity, or might not be like physio or Pilates, but it might be, another kind of activity, maybe yoga or sport. But always just starting gradual and making sure it's enjoyable first and foremost.
Yeah, most definitely. It's much more motivating when it's something that you enjoy. And I know you mentioned several times be gentle, and I think what you're referring to as well is non-judgment. Why is non-judgment important in your work, whether it's, from your perspective or from your client's perspective?
I think exercising can be scary. I think it's, scary if you're on your own, or scary if it's new. I mean, I know sometimes when we're getting back into the gym, I feel awkward. Like, am I doing this right? Or are people looking at me? And when you're a woman, or even just what you're wearing, like, you might be doing like a squat, and you're like worried about who's looking at you. And I want my space to be a safe space for people to move, no matter what level they're at. And if you don't get something right away, that is okay. We will work on it, or we'll skip it and never do it again, depending what it is. And I just want people to feel comfortable and not feel judged. And it really is an inclusive environment. And again, that's why I love the reformers, because I can modify things so that a person feels comfortable. And I want people to be able to laugh about it. And it's not serious. We just move on, and it's just not a big deal if you're not getting it. And that's why we work together. And I'll find exercises that the person enjoys. And I just think, we're judged so much day to day. And, you want exercise to be your medicine. You want to like it. You shouldn't feel judged when you're doing it, no matter what level you're at. So I just think that's like the most important thing when starting fitness, is just being kind to everyone around you, but also yourself, and just not judging others either in the class.
Yeah, thank you. It's so inspiring to hear that from you. And, to create that environment is really a gift. How might women adapt their self-care practices for joint health in times of higher stress?
So I think, I mean, of course, you want to make sure you're eating well, and you want to make sure you're sleeping and exercising, but that's not always realistic when it's a really stressful time. And I just think doing something that you like to do and something that you love is the best way to manage your stress. And that could be anything. It could be journaling, could be meditation, yoga. For me, it's like baking or cooking. I think just being able to take that time for yourself and do whatever you want to do is important. And I mean, of course, get the sleep and eat well, and look for maybe a non-inflammatory diet or what have you, and um, just make sure, but at the end of the day, just make sure you're taking time for yourself. And it's not always like that typical, I mean, eat well, sleep well, move well. It's just do what you want to do. And maybe it's just, again, going for a walk, baking, knitting, could be really anything. But I think just as long as it's enjoyable and as long as she can take time for herself, I think that's good.
Yeah, definitely. Couldn't agree more. Taking time for yourself and carving that out is really important, and filling your time with things that bring you joy, especially when there's higher stress, because we need to mitigate that. And of course, the other health habits are important too. But I think it is important to really be able to shift your state. So thanks for sharing what you love and that women can look out for to do in their own lives. I'm curious too, because we didn't quite cover this, but if someone specifically had surgery to a joint, what are some myths around exercise with that? Because I know, the rehabilitation or training process after might be a little bit of a journey.
Mhm. So it's kind of funny because I actually also work at the hospital part-time. So when on the weekend, I actually get to work with the surgical joint. So it's kind of cool to see all these different phases of rehab. And I don't follow those individuals like at the clinic or anything, but it's still really cool to see how they are after the surgeries. I definitely have noticed, and again, each person is so different. It's really hard to just generalize, but those who have been active before they really do well after. And I mean, as long as you do your exercises, things are usually good. But some myths are, my exercise days are over. And I mean, I think that's false. I think, if, you keep up with your exercises and you follow what the surgeon says. And I think, you can engage in those hobbies and activities. That's kind of why you probably got the surgery, is so that you can go back to the things that you love to do. And I mean, of course, pain, but I think you can still exercise afterwards. Maybe not like super high impact stuff, but to say your exercise days are completely over is definitely not true, because it is important for overall health too, right? You don't want to get this surgery and then you stop moving and then now you have all these other health conditions. So just, I think staying active after is super important. And then surgery is the only way to fix an arthritic knee. I mean, not true. That's what kind of we're here for, right? And the surgeons usually want to try conservative treatment first. If that fails, of course, then they'll talk and work together to decide if the surgery is appropriate for that person. But I mean, we do physio and Pilates or what have you to kind of either prevent the surgery or put it off for a little while. So I would say those are kind of like two myths that I would see. But I mean, yeah, people do really great. And again, everyone's so different. Everyone has different health backgrounds and exercise levels. But those who have been active do pretty well after, and they're back to doing what they love.
Yeah, and it's great to explore those, because I think the more we can break down myths in healthcare, the more we can encourage people to get back to doing what they love most. I'm curious too, because I think this will help a lot of people in our audience. And I know that I've experienced this in my practice, where patients are working with, an amazing physiotherapist, and they've been given exercises to do. And they're like, I'm having a hard time staying consistent with it, or I'm not quite following through. And do you have any tips to help people, be more consistent about their exercises? Because they know they help, but sometimes they fall off. What can people do to stay on track with that?
So I use a really cool app called Embodia, and I've actually had really good feedback with this. I thought it would be annoying for people, and I use it mainly because it has videos for exercises, but it actually reminds them and sends them an email. So they'll get a little ding or a little reminder saying it's time to do your exercises. And people have said, like, this is so helpful to keep me on track. So that's been really good. If you don't have Embodia, I mean, set a timer. Most phones have like a reminders app now, or I'm sure you can find an app that will remind you, and just kind of set it off however many times a day that they were prescribed to you. I mean, I think it's good to take breaks too, but depending on what your personal physio has prescribed, those are kind of some suggestions there. I think incorporating them into your routine too. So if I give someone an exercise that's on their back, I'll say, do this first thing in the morning when you're in bed. There you go, it's done. Or if there's an exercise they can do when they're at work, I'm like, that one's for work, do it while you're at work. You don't need any bands or anything. You could, it might be like just squeezing your shoulder blades together. And, I always say that's a good one to do at work. And I try and incorporate it into the routine. So it's not like, oh my God, I'm doing hours of exercises and this is so exhausting. And I think just trying to fit it in with their life is important, but also setting those little reminders can be helpful too. And again, I like to use that Embody app. I think it really holds people accountable. And it's kind of funny because there's a part of Embodia where they don't have to, but you can check off if you've done them. And people think that I'm watching that, and I'm not. And I always tell them, like, you don't have to check it off as long as you're doing them. But I think people kind of get like, oh, I better check it off so she knows that I did them. So that's been kind of helpful too.
So true. Accountability, notifications, and being strategic about how you're integrating it into your day. I think that's awesome. Really good to know. And those are some strategies that I use too in my clinical practice, because I think it's important to not feel like you have this like extra task on top of an already really busy day, but just being more strategic about how you're integrating it.
Yeah, definitely.
Awesome. So I have a final question for you, Ali. Resilience is a topic that is so important to women's wellness, and it's a topic that I love so much. What does becoming more resilient mean to you, and how does this relate to the women that you treat?
I think more resilience just means like taking challenges that life throws at you and just becoming a better person and just becoming stronger because of them. Not letting those hardships kind of take over or define you or your career. And I think, as a new grad, especially, it can be kind of daunting being in a city with so many fantastic physios that sometimes I get overwhelmed with feelings of, maybe not feeling good enough or, smart enough or maybe just not confident enough. And instead of, dwelling on those feelings, I keep pushing forward. I keep taking courses. I ask for help. I get mentored. I research. And I mean, I learn from my clients too. And every experience I have is a learning experience. So I think just continuing to push forward. And I have so many clients that come in here or into the studio that life just throws them all these curveballs, and they are the most positive people. And it just puts life into perspective for me. And it just kind of allows me to take a step back and just be more thankful. And it's just inspiring to see them going through all these obstacles, but persevering and being a part of that journey is really incredible. And again, like some people, like when it rains, it pours, and they are just so positive, and I can't even believe it sometimes. And it really just, it's a learning lesson for me. And I'm just thankful that some days I'm like, I'm so happy that I can even just walk. Like I have legs that work. And to me, like that is amazing. Some people just don't even have that, but they still show up to the clinic. They still show up for their appointments. They come to Pilates classes, they just had a baby. They're probably going through a bunch of stuff mentally, but they show up, they just try and do the best for themselves and for their family. And I think that's incredible. The fact that they still come to physio, come to Pilates, it's just awesome. And they probably have a million other things going on. So I think that is just true resilience. And me being able to be their cheerleader is just really awesome. And I'm very privileged to be a part of that journey.
Oh, it's so amazing. Thank you so much for being here today, Ali, for sharing all your wisdom and knowledge and experience. I have no doubt our audience is going to benefit. Thank you again.
Thank you so much for having me.